Hello everyone. So today I'm going to discuss the procedure of IUI or intrauterine insemination. So intrauterine insemination or artificial insemination, this is a very simple procedure for infertility. And what is it and what are the steps for it? So let's discuss that. So it's a procedure where sperm is collected, washed and concentrated. Basically the sperm preparation is done after the husband gives the sperm sample, post which they are placed directly into the uterus during the ovulation. So what basically happens, the treatment has to start right on the second day of the periods. Okay, that time ovarian stimulation is being done by medicines and injections also. Then egg tracking or follicular study is done, in which the doctor will call you every third to fourth day depending upon what procedure, what ovulation stimulation is being given to you. Egg tracking is also known as follicular study, follicular monitoring, and it is done by ultrasound. When your egg will be mature, so normally we are targeting in IUI 2 to 3 eggs. When your eggs are mature, for rupture of those eggs, some injections would be given, and post the injection around 36 hours you will be again going to the lab where your husband will be giving the sample. The husband's sample is being processed, and the best sperms are loaded into a very thin needle. And then it is just put inside the uterine cavity. Okay, so the whole idea is what, that the egg has ruptured, and from whichever side the egg has ruptured, it will come, and in the fallopian tubes the sperms will travel, and there will be a chance of pregnancy. So in this, the most important criteria is that the tubes should be patent. At least one or both the tubes must be patent. This has to be documented before going for the IUI procedure. Also remember, these are the best sperms. During a normal intercourse, normal insemination, sperms are deposited in the vagina, which they have to travel this whole long. So to decrease the length of the travel of the sperms, which will spend a lot of energy, the best sperms are taken which have to travel only a short distance, so that there is increased chances of pregnancy also. So after the centrifugation and sperm washing, the best sperms, as I told, are loaded into the urine and into the uterus, and after this the patient is given certain medicines called as progesterones, assuming that if pregnancy happens, those progesterones will give the pregnancy support. This is an insemination process. Basically it is in the fallopian tube. Okay, pregnancy always happens in the fallopian tube, and after IUI after 15 days medicines will be going, and after that the pregnancy test can be done. So what are the IUI recommendations? Mostly the male factors, when they are subfertile, subnormal, or the motility is low, some low amount of volume or a low amount of the count. In those situations, IUI is always recommended. Also, if the male partner is having erectile dysfunctions or premature ejaculations, in that case also the sperm collection and putting in the uterus will help. For PCOS females, anovulatory infertility is very good. You get good outcomes in the PCOS case. Suppose for any reasons the couple is going for donor semen, then also sometimes unexplained infertility also, IUI is helping. As I told you, the sperm count is low or the sperm motility is low, in that case IUI is going to help. And sometimes a non-consumption of marriage. Please know, IUI, whenever it is done, the patient is absolutely pain free. There is no anesthesia or analgesia process required. Patient is good to go soon after the procedure, and there is no bed rest required. However, IUI is offering only 15 to 20% success chance in one cycle, but if this cycle is repeated properly for over 4 cycles, the success chance is almost 50%. Thank you so much.